Hello friends, welcome to Easy Nurse, where nursing education made easy. Under physiology unit of blood. Today in this session we have an important, a complex and a vital defense system that acts as a resistant, that acts as a barrier between the pathogens, between the virus, the bacteria and other any foreign substances and the body, and prevents our body from various kinds of illnesses, diseases and any other immature or any other immerse conditions, and acts and maintains the well-being of our body. That's the body's immunity, the immune defense system. The immunity, the resistance that the body shows, that the body possesses against the pathogens that can enter into our body and can cause any type of disease. So our immunity is a resistance that our body possesses in order to protect and maintain the well-being of our body. So let's join and understand this body's resistance and understand this body's ability to deal with those pathogens and to kill and to destruct those pathogens, including the virus, the bacteria or any other type of foreign substances. So the immunity is actually a major part of the immune system. The immunity is the body's ability, the resistance to resist and to defend against the pathogens, against the foreign bodies, against the microorganisms that can cause illness, that can cause disease and abnormality in our body. So that's what immunity is. And this immunity is not a simple step. It's not a single step process. Rather, it's a complex process that involves multiple activations, that involves various kinds of substances, chemicals and proteins, and involve them in defending, in protecting and in destroying those pathogens and preventing our body from such kinds of changes, such kinds of alterations. So there are basically two types of the immunity. The one is the innate immunity, which is also called as the native immunity, and the second one is the acquired or the adaptive immunity. So this is further being classified into different types. One, we told that the immunity is having adaptive immunity and there is having a innate immunity. Now what about this? The adaptive immunity will further be classified into different groups. Our adaptive immunity will be classified into the natural adaptive immunity and the artificial adaptive immunity, and these two will further be classified into active and the passive immunity. The passive immunity, which is the maternal, and finally the active immunity of the natural one, and artificial will also be divided into the active, passive and the active immunity. We are going to deal with innate as well as the adaptive immunity in detail. So let's join to understand the innate immunity, or also called as the native immunity. The innate immunity. So by the name itself, innate means something which is present from the cell, which is present from the first time. So innate immunity is basically a type of immunity which an individual possesses, which an individual has since its birth. So whenever an individual is born, he is having a type of immunity. He is able to defend with some of the microorganisms. He is able to defend with some of the pathogens at the time since his birth. So that type of immunity is called as the innate immunity. It's also called as the native immunity. It's also called as the non-specific immunity. That's very important. It's also called a non-specific immunity, or it's also called as the inherited immunity. Okay. Why? Because it's inherited from the birth itself. You are having such kinds of substances, such kind of defense system that's protecting you from the pathogens and microorganisms. And why is it called a non-specific? Because your body is having such type of defense. It is not related to a particular type of virus. It is not related to a particular pathogen. It is not related to any type of particular foreign body. Rather, whatever comes inside that can harm our body is going to destroy them. Our body is going to defend from it. That's what innate immunity is. It's non-specific. That's very important, because it's not specific to a particular virus like COVID-19, like any tuberculosis bacteria, like any other type of bacteria and virus that can cause particular illness in our body. So whatever comes, whether it is bacteria, whether it's virus, whether it's any other type of foreign body is entering into our body is going to respond. Our body is going to defend. That's what innate immunity is. So got it? Now, apart from that, it's very important that it is the first and the primary line of defense. So your first defense system is the innate immunity. So whenever anything enters into our body, first innate immunity is going to deal with that. That's where innate immunity is. Now let us see what is coming under the innate immunity. So we have the macrophages. Already we have dealt with what are the macrophages. The macrophages are going to, they are going about the process called phagocytosis. So they are dealing with the phagocytosis. They will engulf the bacteria, they will engulf the foreign body and will destroy them. And we have the natural killer cells. Already we have dealt the mast cells, which release the different types of chemicals like histamine and prostaglandins and other cells. And the monocytes we have that are going to differentiate into the macrophages in the tissues. We have the neutrophils, we have the eosinophils, we have the basophils. So these are the cells which are going to take part in your innate immunity. Clear? Now there are some factors that are going to affect our innate immunity. So I told you it's from the birth. Whenever a baby is born, he is having a type of defense system. He is protecting himself. He is protecting the body from different types of pathogens by means of innate immunity. So what are all the factors that are going to affect? We have the age. The first thing is the age. So the innate immunity will be differing in the age groups. We have two types of vulnerable groups in our individuals. What are those? One is the children's and another is the old age. So in children's, the immune system is not yet matured enough. So they have an immature immune system. So what does that mean? When your immune system is immature, you are not going to able to defend properly. You are not going to properly protect your body from the pathogens. So because of that, you may lack some of the conditions. You may lack some things in protecting your body. So it can cause some of the illnesses. It can result in some of the vulnerable conditions or some of the alterations in the body. Same is the case with the old age. In old age, what happens actually, the immune system is deteriorating. It is going to worsen with time. So as the age increases, what happens? Your immune system, the functional property of your immune system also reduces, also decreases. So when that decreases, the ability to fight with the pathogens also decreases. So these are the two vulnerable groups that are more prone to infections, that are more prone to attack by the pathogens because their immune system is not properly active or not properly working. Next is the nutrition. Your nutrition also plays a role in the immunity. In the case of malnutrition, where there be mostly the deficiency of the various nutrients in our body, what happens? Your cell-mediated immunity and the humoral immunity will both be affected. It will reduce. So your type of producing the antibodies and the T cells will also be reduced in case of malnutrition, especially in case of the kwashiorkor, which is the protein deficiency of our body. So what happens in that case? Your cell-mediated immunity will be reduced. And finally, we have the hormones. The hormones which take part in most of the functions, most of the activities of our body. If there is any alteration, if there is any change in the levels of hormones, that's also going to affect our immunity, such as the case in case of our diabetes, in case of our Graves' disease, in case of thyroid dysfunction. So in these cases, the hormone level will be changed. It will be altered. So that's going to affect our immunity. That will reduce our immunity and that can increase the susceptibility to our infections. Clear? So that are the factors. Now let's understand what is the mechanism behind this innate immunity. How in our body, what we can say is the innate immunity. Okay. So coming towards the innate immunity, as I told you, these are the type of cells which are going to take part in the innate immunity. So apart from that, we can distribute it in a physical way, the chemical ways. Okay. So in types of physical barrier to innate immunity, that's a natural type of defense, is the skin. So our skin is the primary defense system that acts as the barrier between our body parts and the external environment. So any pathogen cannot enter into our body because we have a skin layer, a type of organ, a specialized tissue, a specialized organ that protects us from entering the pathogen into our body. Apart from that, you will see hair particles, you will see different types of secretions, different types of chemicals on our skin. So that they are going to destruct, they are going to minimize the microorganism account on the skin layer. Apart from from that, we have the tracts, the gastrointestinal tract, the intestinal tract, the genitourinary tract. In mouth, we have saliva. So that saliva has different types of chemicals that can protect us from the bacteria, from the microorganisms. In stomach, we have increased acidity level there is decrease in the pH. That means increase in the acidity level in the stomach. So that is going to attack the microorganisms and destruct those. In intestine, we have the intestinal flora that is going to reduce the colonization of the pathogens. In the urinary system, we have the urine that flushes out the bacteria, that flushes out the microorganisms near the urethra. And especially in the females, in the vagina, we have an increase in the acidity in that particular region of the vagina that reduces the growth of bacteria, that reduces the growth of microorganisms in the vagina of the woman and protects the growth and colonization of the bacteria and microorganisms. That's how it plays a role. Our eyes, we have the tears in the conjunctiva that's going to protect, that is going to flush out the bacteria. There's a present a chemical, the lysozyme. That lysozyme also protects our body, also protects our eyes from the bacteria and other microorganisms. That's how it plays role. Our inflammation, our fever, the fever is also type of innate immunity. When the body temperature rises, it is going to, at a one stage, it is going to destruct the colonization of the bacteria. That's how it plays a role in case of innate immunity. And apart from that, we have different types of chemicals, we have different types of proteins that also play a role, like the C-reactive protein, like we have the interleukins in the blood. They are also taking part in the innate immunity. As I told you, we have the macrophages, the neutrophils, we have the natural killer cells, we have the types of WBCs that play a part in the innate immunity. That was all related to the natural innate immunity that's already present in your body from the defense from your birth. Now the condition is that when the pathogen enters into our body, suppose your innate immunity is not able to deal with this pathogen, your innate immunity fails to defend your body, what is going to happen? Then there is the second role